Hi, everyone. Welcome. Thank you for taking the time out of your evening to learn about such important issues tonight. We're excited to be celebrating Asian American, Native Hawaiian, Pacific Islander Heritage Month with a discussion on the importance of centering AA and NHPI voices in conversations about public health and child nutrition. My name is Brittany Van Pelt, and I'm the Policy Communications Associate here at the National WIC Association. We want our event this evening to be about taking action and learning more about the ways you can center AA and NHPI voices in your agencies and clinics. So we'll be sharing resources after this event. For those of you that don't know, the National WIC Association is a nonprofit voice, the only nonprofit voice of the 12,000 public health, nutrition, and provider agencies and the over 6.3 million mothers, babies, and young children served by the Special Supplemental Nutrition Program for Women, Infants, and Children, also known as WIC. And I'm excited to be introducing one of our partners tonight, the Asian American Health Forum, which is the oldest and largest health advocacy organization working with Asian American, Native Hawaiian, and Pacific Islander communities across the nation. By providing policy and political analysis, research and data support, and effective communication strategies, this organization supports local AA and NHPI communities to have an influence on local, state, and national policy. By providing grants, training, and technical assistance and consulting, the group is a source of key resources so that communities can mobilize and grow stronger in their coalitions and organizational structures. So before we start with an introduction of our panelists, I want to talk a little bit about what AA NHPI Month is. Asian American and Pacific Islander Heritage Month is a period for the duration of the month of May to recognize the contributions and influence of Asian American and Pacific Islanders to the history, culture, and achievements of the United States. A rather broad term, Asian/Pacific encompasses all of the Asian continent and the Pacific Islands of Melanesia, Micronesia, and Polynesia. So, sorry, Zoom logistics. So now I'm gonna move over and introduce our panelists. So let's get started. First, we have Darlena Birch. She is the Senior Public Health Nutritionist at the National WIC Association. She began her career in the WIC program at the local agency level, working in the rural county of 8,600 residents on the Arizona-New Mexico border. She worked as the local agency's WIC director and registered dietitian before moving to the Arizona WIC state office in Phoenix. In a continuous effort to explore and expand her horizons, Darlena then moved from the West Coast to the East Coast, where she worked as the training center nutritionist with the Maryland WIC state office. Currently, Darlena's work involves representing NWA at stakeholder meetings, participating in advocacy efforts, and collaborating with NWA partners, coalitions, and task force to promote and elevate the WIC community's nutrition and breastfeeding related successes and concerns. Welcome, Darlena. Next, we have Lily Shen. Lily Shen is the Managing Director of COVID-19 responses at the Asian and Pacific Islander American Health Forum, who supports Asian American, Native Hawaiian, and Pacific Islander populations across the nation. Lily is supporting the National AA NHPI Health Responses Partnership and managing three of the CDC's funded COVID-19 projects. She is also supporting AA NHPI frontline healthcare workers by convening a national collaborative of education and training opportunities. Lily is serving on Morehouse School of Medicine National COVID-19 Resiliency Network's Community Coalition Board. She holds a BA in International Relations from the University of California, Davis, and a master's in International Affairs from Pennsylvania State University. Welcome, Lily. So now I'll kick it off to our first presenter, Darlena, who will talk about cultural nutrition access and food insecurity in AA and HPI communities.
Thanks, Brittany. I'm so excited to be able to speak with everyone this evening regarding food insecurity and cultural nutrition access in Asian American Pacific Islander communities. So while I load up my slides, I want to move to this next slide where I talk about just a high-level overview of Asian Americans. So Asian American citizens are the fastest growing racial ethnic group in the US. And so on my slide, you can see that the 6 largest Asian American subgroups are Asian Indians, Chinese, Filipino, Japanese, Korean, and Vietnamese. That altogether, they comprise approximately 97% of the Asian American population. And I just wanted to point this out to bring up the fact that Asian Americans are a heterogeneous group. with unique socioeconomic profiles and language abilities. And there's a wide spectrum of education, household income, and language ability with Asian Indians in the higher end, with Koreans and Vietnamese in the lower range of these standard socio-demographic indicators. So on my next slide, I just want to transition into discussing food insecurity specific within Asian Pacific Islander communities. Food insecurity remains a major public health issue in the United States. And even though this is a fact, there is a massive lack of research among Asian Pacific Americans, and this continues to be an underreported issue. Essentially, data on Asian American health, particularly for these Asian subgroups, are scarce, and many health disparities for this population group remains unknown. And the reason why I want to bring this up is to say that many of the stereotypes that are associated with Asian Pacific Americans, but basically the reason why they exist is because there just isn't much research that's really being done on both the national level and within the scientific community to kind of delve deeper into some of the nuances within this community. So stereotypes that all Asian Pacific American people are well off, highly educated, gainfully employed, or are otherwise deemed as model minorities obscure the reality that an untold number of APA people struggle with food insecurity and poverty. According to the Urban Institute, poverty rates are actually quite high among several APA ethnic subgroups. And food insecurity, its root cause, which is poverty, does not discriminate depending on race. It can affect anyone, and they harm individuals, families, and communities across the US, regardless of the demographic. And as I stated earlier, one group that rarely receives attention for these alarmingly high levels of food insecurity and poverty is the APA community. And why I want to bring this up is because this oversight is basically detrimental for the APA community and the nation as a whole. And so now I'm just going to move on to my next slide, where I point out that despite these findings, AP people often do not participate in safety net programs that are designed to help people in need like them. And exacerbating this issue is the recession that's resulted from the COVID-19 pandemic. And because Asian Americans who are already struggling with food insecurity and poverty rates before the health crisis, they're feeling these negative impacts even more now for a variety of reasons I think Lily will dive deeper into after I finish my talk. But I also want to finish out this slide by pointing out that immigration status and language barriers have long made food access in some Asian American communities a challenge. And the pandemic and recent waves of violence and harassment have not made this situation any better. So on my next slide, I want to switch from talking about food insecurity to talking about issues with data collection. As I pointed out earlier, there is a lot of issues with the data collection within the APA community, and Asian American citizens are actually the fastest growing racial/ethnic group in the United States. Nevertheless, data on this group is scarce, and many health disparities for this population actually remain unknown. Much of our knowledge of the Asian American health, much of the knowledge regarding community for the Asian American group has been determined by studies in which investigators have either grouped Asian American subjects together or examined one subgroup alone. National health surveys that collect information on Asian American race ethnicity frequently omit this population in research reports. And when national health data are reported for Asian American subjects, it's often reported for the aggregated group. And basically what that means is they're lumping all Asian Americans together and they're not differentiating across the subgroups. Therefore, this aggregation masks many of the differences between the subgroups themselves. Additionally, when the health data is reported for one subgroup, it's often applied to the entire group. One example of this is the Nihon San study, where investigators examined cardiovascular disease in Japanese men living in Japan, Honolulu, Hawaii, and San Francisco, California. The findings from this study was then incorrectly extrapolated to all other Asian Americans. And so it kind of works both ways. When they're collecting data, they're either not differentiating between the subgroups, or they study a subgroup and apply it to the entire demographic itself. So on my next slide, I want to talk a little bit more about these issues with aggregation. Recent policy implementations, such as the White House Initiative for Asian Americans and Pacific Islanders, and the body of literature demonstrates the importance of addressing the heterogeneity in this population. And I just wanted to bring up a couple more studies that point out to the importance of really pulling apart these subgroups. One study found that in evaluating the American Community Survey, when compared to whites, Asian, Indians, Japanese, and Filipinos were less likely to be living in poverty, while Chinese, Koreans, Vietnamese, and several other Asian American subgroups were more likely to live in poverty. Therefore, this contradicted the model minority myth. And in an evaluation of hemorrhagic stroke risk among Asian Americans and other ethnic groups, one study noted that while Asian Americans reported a higher risk of such stroke compared to whites, the rate was only explained for Japanese and Filipinos, thus demonstrating the heterogeneity in chronic disease risk among the Asian American population. And so basically, I just want to highlight the point that we really need to disaggregate research in the Asian American population, because this is key to ensuring healthier outcomes of the nation population as set forth by Healthy People 2030. And while evaluation of the burden of food insecurity among minority populations is prevalent, it is important that for everyone to recognize that little assessment is being done to look specifically to the Asian American subgroup. So now that I've talked about some of the, data issues, because I feel like it's really important for us just to understand the nuances for why some of these stereotypes persist, I now want to talk about the WIC Food Package and how it's beneficial in terms of helping, Asian American communities meet their nutritional needs as well. So on my first slide, I just want to talk about the positive health outcomes of the WIC program. And for anyone who's watching this event that doesn't really understand what WIC is, the Special Supplemental Nutrition Program for Women, Infants, and Children is the premier public health nutrition program ensuring the health and well-being of program participants through the provision of nutrition education, breastfeeding support, supplemental foods, and referrals to health and social services. WIC plays a role in addressing and WIC does play a vital role in addressing maternal mortality through nutrition. So I also want to highlight how WIC helps not only support, the WIC participants' nutritional needs, their breastfeeding needs, and providing referrals to health and social services, but it's also helping to address maternal mortality across the US. And WIC addresses both micronutrient and macronutrient needs of the population through its prescriptive food package, which is tailored to the specific life stage of the participant. And so on my next slide, I'm going to talk specifically to the WIC Food Package itself. The WIC Food Package provides a wide array of healthy foods to supplement the diets of the mothers and young children and infants who participate in the program. And as mandated by the Healthy Hunger Free Kids Act of 2010, the WIC Food Package is reviewed every 10 years by the National Academies of Sciences, Engineering, and Medicine. The latest review by NASM was concluded in January of 2017, and this process was carried out with essentially 4 key things that they need to keep in mind. It needs to be based on science and align with the most up-to-date dietary guidelines for Americans. It needs to meet the nutritional needs of WIC families. It needs to be culturally appropriate, which is going to be the highlight of my next few slides. And it also needs to include foods that appeal to WIC families. This process ensures that the foods included are scientifically proven to supplement the nutrients lacking in the participants' diets. And in addition to this WIC Food Package, WIC mothers and young children receive a cash value benefit, abbreviated as CVB, to spend on fresh fruits and vegetables of their choice at the grocery store. So on my next slide, you can see a picture that I took from the NASM 2017 report. The report is actually, as you probably saw on the previous slide, it was over 900 pages. But one of the things that they really highlighted when providing recommendations to the new changes to the WIC Food Package, they wanted to emphasize the importance of ensuring that the WIC Food Package is culturally appropriate to the participant. So the committee was charged with ensuring that these revisions were culturally appropriate. And so I just wanted to bring up that picture, as you can see, to just further emphasize the importance of trying to ensure that the WIC Food Package meets the largest, the needs of the most WIC participants possible. So my next slide, I talk about recommendation 6.2, and that one is specifically related to cultural appropriateness of the WIC Food Package, in which NASM stated that USDA FNS should support the cultural food preferences and special dietary needs of WIC participants by requiring states to offer additional options for the WIC food categories, including substitution of a CVV in place of juice, additional forms of vegetables and fruits, both canned and dried legumes, and a range of options and sizes for grains and yogurts. A substitution of legumes for peanut butter or for eggs should be allowed for individuals who have a peanut allergy or that are following a vegan diet, respectively. So that last part isn't incredibly relevant, but the previous section was, and the reason why I wanted to go deeper into that specific recommendation is because, when people think about Asian Pacific Americans, you tend to, I think people have like a very vague or high level understanding, but when you're looking at the WIC food package and some of the things that are provided, even if you're to break up the Asian continent by regions, if you look at East Asians versus Southeast Asians, tofu is a big thing that is big in like the diets of Chinese Americans, Japanese Americans, Korean Americans. But if you start looking at Asian Indian Americans, tofu isn't a thing. They have more dairy products in there. And so when you look at the WIC food package, tofu is an allowed substitution in the WIC food package, but not every Asian American WIC participant will be using tofu because it very much depends on what part of the Asian continent that they're coming from. Likewise, there's a lot of milk that's issued in the WIC food package, and there are certain Asian subgroups that don't really drink a lot of cow's milk or even really use dairy, whereas other Asian subgroups will. And so I just wanted to bring up this recommendation from NASM to just really highlight the opportunity that USDA FNS has in moving forward with the report, as they are the federal agency that will push forward the recommendations into the WIC food package. There's so much opportunity within the WIC program and within the WIC food package itself to really help better meet the cultural needs and dietary preferences of the WIC participant. And, and at NWA, we work tirelessly to help and make sure that we are trying really hard to improve the WIC program so that it serves the participant the best. And so those are my slides for today. My last slide has my contact information. So if anyone has any questions, feel free to send me an email on the slide above. And now I'm going to turn things over to my co-presenter, Lily.
Awesome. Thank you, Darlena. It was great to learn everything. All right, so thank you, Brittany, Natalie, and the WIC Association for this opportunity to share the Asian Pacific Islander American Health Forum's work to serve Asian American, Native Hawaiian, and Pacific Islander communities during this pandemic. Again, my name is Lily Shen, and I'm the Managing Director of COVID Response at the Health Forum. Let me talk a little bit more about the Health Forum. We are a national community organization network to disseminate in-language materials and culturally tailored information to better serve the nearly 23 million Asian American, Native Hawaiian, and Pacific Islanders across the country and its territories. Especially during this time of COVID, the need for language access and cultural competency are greater than ever. And so since the start of the COVID pandemic in the US, the Health Forum has been at the forefront of responding to this public health crisis at the national level. The Health Forum, as I listed here, launched 2 seminal initiatives, which continue to stand as the broadest efforts of their kind. First, we've collaborated with our national CBO network to ensure that our Asian American, Native Hawaiian, and Pacific Islander communities are supported during this time. We created a community library with, I believe now, over 700 materials in over 40 Asian American, Native Hawaiian, Pacific Islander languages, including Spanish as well. And this link I will have on the last slide of my presentation. And thus far, this resource has received over 7,000 hits. In addition, in April of 2020, we did conduct an initial rapid community assessment to design the right policy recommendations and program support to our community-based organizations on the ground. This assessment received over 45 respondents from over 23 states in every region of the country. Some key findings I'd like to share is a need for language accessible COVID resources, funding for community programs and organizations, as well as benefits, food, and small business support. Next slide, please. So with the partnership that's stretched over 25 years with CDC, whenever there's a public health response needed at the national level, the Health Forum has been that partner for NHPI communities, whether it be ending the HIV, AIDS epidemic, H1N1, Zika, and now COVID. CDC has continually turned to the Health Forum to lead the national AA and NHPI health response. So here I've listed several of our partners who sort of represent a range of local, state level, and national organizations who also work in a range of fields and disciplines, whether it be labor, civic organizations, advocacy coalitions, as well as public health. And so we are incredibly grateful for the opportunity to partner with CDC Project First Line to implement a infection control education and training initiative to serve our Asian American, Native Hawaiian, Pacific Islander health facility workers across the country. This is a partnership with CDC as well as with their community partners. The Health Forum is utilizing appropriate information technology platforms to support our frontline healthcare workers with infection control, education, training materials, and in-language resources. And also, in addition, the Health Forum launched and is maintaining a NHPI webpage to share and disseminate this in-language resource. I will drop the link as well in the last slide. And so we have developed so far in-language resources for 8 AA NHPI languages. This consists of Bengali, traditional Chinese, simplified Chinese, Tagalog, Vietnamese, Hmong, Samoan, and Tongan. And so the main focus of this project is to equip our CBO partners, healthcare workers, to be active participants in infection and control culture and to spread that awareness to their fellow peers. In addition, the second CDC-funded initiative we are working on is called Forging Asian American, Native Hawaiian, and Pacific Islander Community Partnerships for Rapid Response to COVID. The objective of this project is to provide evidence-based COVID-19 health messaging to our AA and NHPI communities that are vulnerable to COVID-19. Our mission is to disseminate culturally appropriate, multilingual, and multicultural information, and then disseminate a communications campaign to intervene on the topics of prevention, testing, access to care, and now vaccination. And we're also using a range of data sources to identify subgroups among AA and NHPIs at high risk for infection, hospitalization, and death. Next slide, please. And so the Health Forum and more than 24 local and national partner organizations launched the National AA and NHPI Health Response Partnership to design and deliver these effective interventions. Currently, we're focused on improving vaccination coverage among AA and NHPIs and to implement these strategies to reduce disparities in adult vaccination coverage. In partnership with our community level organizations, the partnership will increase the acceptance of vaccines among these communities, as well as increase access to immunization services. A key part of this program I'd like to share is building the capacity of our community partners across the country to further conduct flu and COVID-19 education and outreach activities. And this also includes connecting their AA and NHPI community members directly to vaccination providers. In addition, the partnership is building upon existing COVID educational messaging and campaigns for both health facility workforce and hard to reach AA and NHPI communities. And again, I will drop the webpage link on the last slide. Okay, next slide, please. I just briefly want to share here a couple of our recent roles that the Health Forum has played for policy initiatives. And, overall, the Health Forum has been advocating on enduring issues such as disaggregated data collection, analysis, reporting, and dissemination for all communities of color, as well as coverage for all residents for COVID-related prevention, testing, access to care, and now vaccination. And I listed some here, but I will drop the link as well so that you can read it further. Next slide, please. So next, I just wanted to share as well our partnership with the Morehouse School of Medicine. The Health Forum is a key partner on 2 of their massive national initiatives. So first, we are a part of their national COVID-19 resiliency network funded by the Federal Office of Minority Health and partnering with the CDC Foundation. We are collaborating here with our AA and NHPI national CBO partners to disseminate culturally and linguistically appropriate COVID resources. We're also part of the Morehouse School of Medicine's Health Equity Tracker and sits on the Health Equity Task Force in partnership with Google.org Fellow and CDC Foundation, as well as the Federal Office of Minority Health. The goal of this is to develop an open database of health equity data, as well as provide a website with analyses and visualizations. Next slide, please. And to just take a moment to share some upcoming events that some of you may be of interest of. So first, on Thursday, June 17 at 4 p.m. Pacific time, the Health Forum and our community partners listed below, as well as our infection control champions, will be facilitating a presentation and discussion on the topic of how COVID strains and how mutations happen, as well as what infection control means for those who do not experience COVID symptoms. This Project First Line training event will be live streamed on the Health Forum's Facebook page. And additionally, we'll also have bilingual champions who will be speaking in Tagalog, Vietnamese, Mandarin, Chinese, and Bengali, which we're super excited for. And after this event, we will also be distributing certificates of completion, as well as providing next step action items for any registered nurses who wanted to apply for CE credit. In addition, on Monday, June 28 at 4 p.m. Pacific time, the Health Forum is hosting a community conversation event on the topic of COVID-19 vaccine barriers. We'll be inviting subject matter experts from the Morehouse School of Medicine, as well as the Philippine Nurses Association of American Foundation. Dr. Mack and Dr. Ramirez, respectively, will discuss the vaccine health equity, topics on sort of distribution and promotion of vaccination rates to minority populations, as well as how best to provide outreach to community members. Our speakers are bringing their expertise on the COVID vaccine and collaboration with community organization partnerships. This event will also have bilingual translators who will be speaking in Tagalog, and we'll also be live streaming this on the Facebook page as well. Next slide, please. Lastly, I wanted to share the Health Forum is celebrating our 35 years of transforming policy and transforming lives. We will be honoring Senator B.Z. Hirono, Representative Grace Meng, Washington Post reporter Dan Diamond, and as well as up to 24 AA and NHPI local and national partners who serve on the national AA and NHPI Health Response Partnership. All right, I think I have a few more slides. So here I just wanted to share a recent resource that we developed with NAPAPA, who is the National Asian Pacific American Bar Association. This collaboration on developing these hate crime toolkits in actually 25 different AA and NHPI languages. We just wanted to really develop a resource to support our communities and how to better understand the difference on, what's a hate crime and a hate incident, how they can work directly with law enforcement and the media, a checklist for community organizations as to how to further support their members, as well as an FAQ sheet. And, our organizations, we are committed to expanding this toolkit beyond. So if any CBOs are interested in, co-developing, we are more than happy to share this resource. And the next slide, please. In addition, the Health Forum and the PAPA also created these Know Your Vaccine Rights fact cards to further support our communities and, whether or not they're unsure if they would qualify, whether it be, immigration status, Social Security, identity, etc. And we also developed these language cards into 25 different AA and NHPI languages. We actually launched this week. This resource, we hope we can further educate community members on the benefits of getting vaccinated, as well as encourage them to receive the free COVID vaccine, regardless of immigration status, health insurance coverage, and Social Security identification. All right. And we have 2 more upcoming resources. This has been a busy month. We'll be launching a PEC video on the topic of addressing COVID-19 vaccine misinformation, as well as launching a COVID-19 glossary of terms and phrases. Both of these resources will be translated or subtitled in these following 10 A and NHPI languages, coming up this Friday as well as next Monday. And just as I referred to above, these are all the links to everything that I mentioned. So we hope this is a good resource for you all. So thank you again for everyone's attention. Thank you again to Brittany, Natalie, and the National WIC Association for this opportunity to share.
Thank you. And I want to thank both Darlena and Lily for your wonderful presentations tonight. So as we close out, I want to leave you with these two questions that can help guide action moving forward in your clinic and agencies when it comes to centering and reaching out to AA, NHPI, WIC participants and potential participants. The first is to think about what are some ways WIC agencies and clinics, specifically yours, could engage more with AA and NHPI communities about COVID, vaccines, and public health. And the second is what information and resources from community organizations and or the CDC would be useful and beneficial to help you lead this action. Please feel free to drop your responses here in the chat or email us at comms@nwica.org. That's COMMS at NWICA.org with your responses. Additionally, we will be sharing all the resources tonight in the chat following this event and in the following AU coming out tomorrow. We want to thank you all for watching and we hope to see you soon.